Rosemary doesn't have a PowerPoint. Waki doesn't have a PowerPoint. Need to, you'll just speak there. Yeah.
Yes.
Mic test, mic test. Do you hear me?
Not through the mic, just
My voice is louder than the mic.
yeah.
Mic test. Like I'm speaking on it, but they're saying it's really soft. Yeah, I think while we're sorting out the mic issue, good afternoon, everybody. Welcome to the session on engaging lessons learned from engaging TB-affected key and vulnerable populations in pandemic governance and leadership. I am very happy to be chairing this session. We have a fantastic lineup of panelists, and very sorry that my co-chair, Austin, from ACT Africa is not here today. My name is Ardi Marte. I'm from the Philippines. I'm with an organization called APCASO, which is a regional health and rights civil society organization, and we convened the Activist Coalition on TB Asia Pacific. So again, this panel, this session is to learn to call lessons on engaging key affected and vulnerable populations in pandemic governance and leadership. We all know, like COVID-19 seems so far away. At the same time, it's not so far away. We still remember the hard lessons that it has thrown us. We remember how it has catalyzed inequities in health responses. We remember how the most affected, the most poor, the criminalized communities are hit the hardest in terms of the impact of COVID, in terms of being able to access health services in the time of pandemic. We also know that in any response, it's the most affected community that gets hit hardest the most in times of pandemic. So there are initiatives. One of them is called the Community Engagement and Leadership and Governance During Pandemic, or KELG. It's an initiative of the Global Fund in partnership with the Stop TB Partnership and the Activist Coalition on TB Asia Pacific and ACT Africa. And the purpose is really to ensure that communities are effectively and meaningfully engaged in pandemic and post-pandemic responses, planning, and preparation. The initiative has started for quite a few months, and with the panel, we aim, with this session, we aim to share the lessons that we have so far and do a reflection with you on what should we learn and what should we be learning in terms of effectively engaging TB-affected community and pandemic governance. Okay, we have a lineup of 5 fantastic speakers from Africa, Asia Pacific region, as well as from France. I wouldn't want to take any more of their time. I would just pass the mic one by one, ask you to self-introduce. You do have 7 minutes each, and then we'll go one by one according to the order of the program. I was told that if you extend your 7 minutes, we would cut on the time of Q&A, so please don't. So we start with Waki. Rosemary is not here, but we have Evelyn. Evelyn, please introduce yourself and then go ahead with your 7 minutes presentation on COVID-19 response, lessons learned from community engagement in the ACTA platform. Over to you, Evelyn.
Okay, good afternoon. I was going to introduce myself as Rosemary Mboro. But then I realized everybody knows Rosemary Mboro, and that's not me. I'm Evelyn Kibuchi. My daytime job is Chief National Coordinator, Stop TB Partnership in Kenya, and have been in the TB business for a long time. So, like my colleague has said, Rosemary could not manage to come, so I'm going to try and fit in her very big shoes. She was going to present on the experience of community engagement during the COVID response. So I don't have a presentation, I'm just going to share the lessons learned. So towards the end of 2019, of course, COVID happened. It was unprecedented. Nobody knew where to begin. And so everything that was done was being done for the first time. Community engagement in such a situation, of course, was for the first time. And so, yeah, let's just see what happened. So, to begin with, global institutions came together, 8 of them, and formed a coalition that was going to see how the effective response for COVID-19, and these included WHO, Wellcome Trust, Gavi, CEPI, Global Fund, UNITAID, among others. Yeah, so the coalition was called Access to COVID-19 Tools Accelerator. And at the initial formation, communities and civil societies were not included. However, later, they came to be included, and a number of representatives from the civil society and communities were included into the Act A. And this Act A had 3 pillars. There was the therapeutic, there was the COVAX, that's the vaccine, and there was, forget the third one, the diagnostic, sorry. Yeah, the ones I forget to remind me. And there was a cross-cutting on the one on health systems, the health systems. Okay, so the role of this civil society organization and the civil society and communities were to work with this coalition to also ensure that community issues were included in the process. So I will quickly go through what were the lessons learned. I was part of the Act A coalition, and yeah, it was quite a long process. And like I said, it was our first time. We did not have previous experience. The only experience we had was drawn from our individual diseases that we worked on. So our first lesson learned, or what I would say, maybe, let me term it a challenge. The civil society, the community and civil society were not initially considered as a partner. We only came to be brought on board about six months later. Secondly, the issue of capacities. Of course, we didn't have the capacities, and we were learning through the process. Other lessons learned is, of course, we would say communities were there, but having a seat in such a coalition was not enough. We needed more meaningful engagement, bearing in mind that we were not coming empty-handed. All of us, or the civil society, we have very many years of experience in our own individual, diseases that we have been addressing. However, we just needed a bit of capacity building to be able to meaningfully, contribute to the process. So one of the lessons learned is that having a seat is not just adequate, but fight for more meaningful engagement. Secondly, the issue of funding. Initially, this team was purely voluntary. We had to take our time off to give our time to the work of the coalition. So it was purely voluntary because our participation had not initially been factored in. It only came in the second year, in the second term of our term, or the second term. Yeah. Again, I would also push for co-creation. That civil society need to be included. They should, when we are thinking about other bodies to be in that coalition, civil society should also come as a first partner, not coming as a second, not being thought as an afterthought. So we need to be included in co-creation, from the planning to implementation to funding at all levels. Civil society need to be included. Of course, the need for investment in our capacities. As I said, this was a new thing, but there were no funds to invest in building our capacities, understanding, okay, this is a new disease, is a new virus. How do we handle it at our country levels? How do we engage in advocacy for this new pandemic that we knew little about? So again, investing in capacity building would be very, very necessary in any other pandemic. We hope none other is coming, but these are some of the issues that I would say they should be considered in future engagements like those ones. Thank you.
Thank you so much, Evelyn. And Evelyn has just talked about ACTA, which is again the accelerator for COVID-19 tools, diagnostics. So the lessons, I would just repeat, meaningful community engagement shouldn't be an afterthought. It should be normative practice in anything, in any decision making, design, programming, planning that involves or affects the people that are that would affect people in whatever plan that gets developed. And then two, it's not enough to be on the table. There also needs to be counterpart capacity building. And three, I think this was also connected to the session earlier. There's a lot of expectations on communities and civil society, and indeed we put a lot of pressure on ourselves and we need to seek accountability, but we also have to think how a lot of the engagement in these advisory processes are actually voluntary, how it adds to the burden of work that we already take on top of the regular work that we have within our own organization. So the thinking of how to support organizations to effectively engage and be resourced is very important. That's part of meaningful engagement. I'm losing the screen, but I know that the next speaker is my sister, Olive. Olive, over to you. Please introduce yourself and the topic. The mic is yours.
Thank you so much, my sister RD and Evelyn. My name is Olive Mumba. Before I can even introduce myself, where I'm currently working is, I always say, if someone was to cut my blood, it will always be part of community and civil society. I may be working with the Global Fund currently, but I come with a lot of experience from working with civil society, and I think most of us here, we know one another, and we've been working together for quite a long time. So Olive Mumba, working with the Global Fund, Community Rights and Gender, but specifically working on community engagement, and coincidentally, COVID-19, moving on to pandemics. My presentation is a summary of a lot of work, not only by me, myself, but from the work that is happening both at the secretariat level, but also through partnerships with ACT AP and ACT Africa. So I don't have any interest to disclose, there's no conflict. My presentation will be around building agile communities and especially community engagement in building resilient and sustainable healthcare systems. This is just briefly a slide that shows the Global Fund's strategy. And if you look, there are three main objectives. One is about maximizing people-centered integrated systems for health to deliver impact, resilience, and sustainability. The next one is about maximizing the engagement and leadership of most affected communities to leave no one behind. And then the third one is maximizing health equity, gender equality, and human rights. If we look at this, it means that we are putting communities at the center of the response. So working with and to serve the health needs of people and communities. Communities and people are the response. When we talk about communities, we're actually talking about people, and people really matter in whatever we do. There is one objective which we are going to be talking about, which is to contribute to pandemic preparedness and response. COVID taught us a lot. So within the Global Fund, when COVID hit, that was in 2019, quickly there was a fund that was made available at country level, which is the COVID-19 response mechanism. Most of the countries responded and requested either for the fast tracking or the full funding. And in the process right now, there is funding which is called portfolio optimization. And we are now talking about portfolio optimization number 2. as we all know, the Global Fund is very flexible. So at that time, it was mitigating the investments in HIV, TB, and malaria. But currently, the shift has now changed. It is now talking more around preparing health and community systems and pandemic preparedness programmatic priorities. And this is making sure that there's increased focus on integration of key response functions and health systems, resilient and pandemic preparedness that should be emphasized, from preparedness, response, recovery, up to mitigation. Within the transition, what the Global Fund has also now done is there's a shift. And this shift is that countries country needs informed the C-19 guidance and priorities for health, which are now fivefold. The very first one is around surveillance system strengthening. The second one is around laboratory and diagnostics. The third one is about human resources for health and community system strengthening. The fourth one is around medical oxygen, respiratory care, and therapeutics. And the fifth one is health product waste and management. I am going to emphasize on the third priority, which is around human resources for health, specifically on community health systems. I want to also underline that COVID taught us that there's so many things that could be done. But one thing is COVID mitigation measure is no longer a priority, but right now it's around pandemic preparedness. So community system strengthening, there are two components that I would want, first of all, to talk about. The very first one is, let me just backtrack a bit. In our new guidance, we talk about the 5 key areas I mentioned, but within the 5 key areas, there's one which is the community system strengthening. Under it, there are interventions, 4 interventions, which are community capacity building and leadership development, community-led monitoring, community-led advocacy and research, community engagement, linkages, and coordination. Why are these key? 2 things. First of all is to make sure that community-based violence is strengthened, and especially making sure that it's strengthened within the health systems and that there are capacities when new pandemics occur. This means that strengthening systems that report, respond, and protect communities against gender-based violence or intimate partner violence. And it's also that it's based within the communities and that there are referrals to the health systems, the health centers. But then the other thing is that there is emergency planning that is able to respond quickly, and that criminalized and marginalized communities are able to access services when they are required. That's the first angle. The second one is around monitoring, community-led monitoring, especially for pandemic preparedness. This, we want to make sure that systems, capacities are able to adopt and respond to disease outbreaks, and also that we are able to monitor human rights. But also making sure that we are strengthening health policies, resource decisions, and also making sure that we are recording complaints and grievance mechanisms. The intervention areas highlighted are specific to systems, capacities, and capabilities for community-led and based organizations. However, critical to note is that gender and human rights-related aspects of pandemic preparedness must be considered. So the Global Fund, even right now, within the C-19 funding, wants to make sure that we continue ensuring that gender and human rights issues are also addressed. Now, RD talked about this community engagement and leadership in pandemic governance initiative, which is an initiative that talks about, 1 minute, okay, so let me just quickly move through. It's working with key and vulnerable populations. I will not talk a lot, but it's about conducting assessments, looking at what are the barriers, and then coming up with an engagement plan. My colleagues Bertrand and Chanthram will talk more about that. I will not say a lot, but just to mention that we are working with ACT Asia Pacific, ACT Africa in 8 countries, 3 Asia Pacific countries, 5 African countries. And mainly, this is making sure that we access and map out engagements of TB key and vulnerable populations so that they are responding, they are part of the response, and then also developing engagement plans, but also documenting lessons learned. There are 2 things as I'm concluding. First of all, universal health coverage stresses 2 points. that we need to build trust. Building a truly inclusive health system, one that engages communities, even the most marginalized, vulnerable, criminalized communities, and leaves no one behind. And then secondly, fighting TB requires multiple components of our health system to be working. Supply chains, community engagement, laboratories, tests, and test and treat pathways. It forces health systems strengthening. Key and underlined, community engagement. We cannot respond to TB, we cannot end TB without engaging communities, and specifically the TB survivors and key and vulnerable communities. With that, I want to say thank you. Bye.
Thank you so much, Olive. So just to reemphasize that at the highest strategic level, the Global Fund funds, recognizes, has the highest respect for meaningful community engagement at all levels of responses, including on pandemic preparedness and response. But of course, how do you operationalize community engagement? We don't always get it right away. The good thing is there's an initiative from the Global Fund, the KELG initiative. I really don't like the acronym, but it's Community Engagement and Leadership in Pandemic Governance, which at this stage implemented in 8 countries in Asia Pacific and in Africa, as Olive has said, at the stage of documenting approaches and strategies for TB, focusing on TB communities, how to engage in pandemic, responses at the country level. So that's the space that we have to watch out for. Yeah, but it's good to have allies such as with the Global Fund in fighting for meaningful and secured spaces for community in a post-COVID world. So the next segment of our panel would be shared by 2 brothers from Asia and from Africa. We would start off with Chantorn and then Bertrand. They would both share experiences so far and lessons from KELG implementation. Chantorn will be talking from the experience Cambodia perspective, and then we would Chantorn, go ahead, and then we would pass the mic over to Bertrand after you. The mic is yours.
Hello. Thank just to confirm, only 7 minutes, right? Yes. Because to share, the result from an assessment, it really hard to to shorten in 7 minutes. My name is Chanton Pong. I'm working with the Khmer HIV/AIDS NGO Alliance called Khana, maybe you know. So thank you so much to the Global Fund and also the ACAP episode and also Africa, for providing, both technical and financial support to run or to conduct this assessment. Maybe I can go straight because of a time, constraint. The tool, there are, how to say, different tools starting from phase 1, phase 2, phase 3, and phase 4. And then the tool 1 is about stakeholder, mapping stakeholders. So, and especially among civil society and also community work or other entity working in a TB program in Cambodia. So that's why we interview with 16 NGO network. And then we found that only 1 NGO working on community engagement. And then right now, there's a new established network that's called TB People Cambodia, starting, to work with community engagement. So this just want to confirm. And the rest working on service delivery, working on technical assistance. Okay, let's go straight to the community engagement assessment. Yeah. So because this assessment was conducted by the local consultant, actually I'm not well, aware much on the result. Otherwise, I try to share as much as possible. So the assessment, the aim of assessment was to collect information and recommendation for strengthening the engagement of TB key and vulnerable population in the national TB response. So Oli already shared, and then the second objective was to make a difference to TB key and vulnerable population. But it can be adapted and used to assess the engagement of all last mile population in pandemic and emergency response. So for the Cambodia case, we were suggested to, to select internal migrant worker. So that's why we already selected construction worker, mobile construction workers as the last mile population, and then it will be confirmed by this assessment. So, like I said, this assessment was conducted by our local consultant, and then we also, how to say, interview with a wide range of stakeholders, including politician, decision maker from line ministry, health management officials, TB, and also health service provider, TB or NGO working on TB in Cambodia, as well as the community network. So we, how to say, we collected, the data from all key stakeholders. And then, like I mentioned, there are 5 phases of this assessment. First was about the preparation, pre-assessment preparation. Second was community engagement, including data collection. The third was data analysis and reporting, and it is underway. And then the fourth is the country level validation, and it will be, it's coming next week, and hopefully our colleague from the regional will join and so provide, further support. And then the last one is a reporting, launching, and dissemination. So this is a methodology of the assessment. So you can see what is the sample selection that we selected. The selected participant, were the NGO and community network, health and TB service provider, and TP management or leaders, technical partner, donors, and line ministry, and also member of parliament. So that's why we collected all the information, all partner or stakeholder. And then the data collection tool, we use KI and also FGD. And then the data analysis, we use the descriptive analytic method. So just want to give you, because like I mentioned, this is very, very first draft of the finding. So I try to, to share the responses, for each question. So the question number 1 was, what are the activity, being implemented right now related to TB, related to COVID-19 or pandemic preparedness, prevention and response. So the response you can see here. So one is, TB awareness raising, TB screening, prevention, diagnosis, treatment and support. The second one is mainstreaming the TB agenda with local authority. So the third one is integrating to integrate TB and HIV programs to ensure TB testing and TBT fully implementation. This is the, the TB and HIV program. The fourth one is to promote meaningful engagement of people affected by TB on various platforms at national and subnational level. The fifth one is to promote engagement of people affected by TB in the Global Fund grant, especially starting from the grant design, development, implementation, and monitoring. The next one is to implement community-led monitoring for TB programming. And the last one, this is really linked to the PPPR. We also implement the risk communication and community engagement for the COVID-19 response. And this particular activity is funded by the Global Fund under the C-19 RM. So the question number 2 was, who are the most at risk, or who are, most left behind during the pandemics. You can see here, it's like most of the respondent participant answered like, it's like in the traditional way, meaning that they just follow the definition of the NTP program or national TB program. They really focus on key VP, meaning like the key population they are working with, but they don't think outside the scope, outside the, the box, the pocket. So that's why this particular thing, we'll see, you can see, we'll see, the other group who are at risk and also left behind. So like I mentioned, in our context, KVP, key and vulnerable population, including elderly people who age 55 plus, people with HIV, people with chronic TB household, migrant, and people with in close setting. But otherwise, we also collected information, also confirm the response around the the less behind. I mean, less behind, people who are left behind. So one is the construction worker. So especially, or in particular, who are working in the painting substance, with painting substance. People living with in slum area and other congregated setting, garment worker, and people working in entertainment worker with close setting, especially for how to say, sex worker or entertainment worker who are working in close setting places. And then we also confirm, we also deeply ask them about, for example, like construction worker. Do you think that you are vulnerability of TB, for example, of having TB? They said yes, because of working environment, because of working condition, because of TB's availability. So that's why they don't know where the TB is with or what the TB or with that they can access. So I think this is, how to say, the result confirmed. So just how to say quickly. So the question number 3 was TB, COVID-19, PPR activity focus on building community system. So you can see the result, the response, using the existing community group and structure such as local authority and village health support group to support TB's visits right now, establishing a peer support group and district network of people affected by TB to support community mobilization and community-based advocacy at local level. Implement community-led monitoring one impact, which supported by the Stop TB, maybe most of you already know. And then the community health worker run community campaign to reduce stigma, TB stigma. And then question number 4 was engaging of TB KVP in the TB, COVID-19 and PPPR. Okay, so I can go to the conclusion. You can see the conclusion here. So the community engagement in TB programming has been implemented actually. While COVID and also PPPR involve community in different way at operational level, meaning that at service delivery, so the people affected by TB or key vulnerable population can engage, at some point. The TB program were implemented with targeting population only according to the national TB program, including program-based intervention, while untargeted populations such as internal construction worker were still not reached during the COVID pandemic. Spaces for community engagement are still limited, and then investment, maybe you already know, the investment for community work, are overlooked. And this is a recommendation, final one, sorry. Like I said, this is the very first draft, and then the validation workshop, will be, done next week. So maybe there will be, some change. So enhance knowledge and skill for community health worker on TB, COVID, and PPPR for their better engagement in the response. Increase community awareness, raising on TB, COVID-19, PPPR among KVP. Ensure the existence of specific community coordinating mechanism from national to subnational level, including committee on TB and COVID-19, PPPR. Strengthen, integrate, and expand implementation of community-led monitoring in TB, COVID-19, and also PPPR. Increase meaningful engagement of people affected by TB in various platforms, but not limited to Global Fund process, CCC, Technical Working Group on TB, and as well as the TB, NSP, development, implementation, and also review. I think this, how to say, very, very draft, like I said, so that's why the result will be changed or will be, how to say, modified. Thanks.
Thank you so much, Chantorn, and sorry for rushing you. We'll go to Bertrand next to talk about draft TB experience in Cameroon. But what I just want to make sure we remember from Chantorn's presentation, when it comes to ensuring community engagement in pandemic responses and response, the importance of building from existing structures, but at the same time, developing new ones as needed. So Chantorn highlighted one of the recommendations is actually to make sure that there's a country coordination mechanism that involves communities at the heart of it across TB, PPPR, pandemic, all pandemics, and COVID-19. That's very, very important because countries are moving towards that direction. We need to be alerted that we have to be on the table. And that doesn't just get given to us. It has to be done with advocacy. Thanks, Chantorn. Over to you, Bertrand.
Yeah, thank you, Elsie. So the presentation we have today is on behalf of a local organization in Cameroon for impact in social health. while I'm the executive director. So today is not on behalf of Draft TV. FIS is member of the Draft TV. Of course, not conflict of interest. Yeah, we dedicate this presentation on behalf of that young, very powerful lady, called Tatiana, because after we produce a film with that lady, the challenge here was to assess the engagement of one specific last mile population, one specific key and vulnerable population in terms of the engagement in governance, pandemic governance. And in Cameroon, we identify IDP, internally displaced population. Why? It's not a good story. Cameroon, actually, we are facing a political crisis in 2 of our 10 regions. This is, we first have to have a specific definition of IDP to avoid confusion between IDP and refugee. So this is what we are facing, our community, our people are facing now in Cameroon. And so this crisis, political crisis, started in 2016. And since 2017, actually in Cameroon, we have more than 6,000 people pass away, and more than 1 million people who are internally displaced. And unfortunately, we still have the conflict, because even last week, we have some of not terrorists, but some of yeah, it's very difficult. And where are those people? The crisis is the 2 regions, but those people, they are displaced in the center region where you have Yaoundé, they are displaced in littoral region where you have Douala, and they are displaced in the west region. The west region is just near of those 2 countries. So this was the objective. Mostly, I will not repeat. The objective was to conduct an assessment and mapping of organizations who can provide support. And we can say that in 2016, the country finalized a new health strategy. But the crisis happened in 2017. But the country finalized a new health strategy. So even the value, even the mission, even the vision of the new strategy is to make sure that every Cameroonian have access to quality healthcare with the full participation of community. But because this crisis started 1 year after the finalization of the health strategy, so we don't have opportunity to have IDP as a key population, as a priority population in the national health strategy. So when we conducted this study, we found first was started by a documentary review. For us was to understand, even we understand it was so hard, because we realized we have the key data, the real data from the UN system. For example, you have national reports, some kind of international NGO also. The idea was where are those people? Where are they living? Where are they working? Where are they, with whom they are collaborating? What is the process, the system they are using to bring their voice, to bring their consent, to make sure that they can participate where they are building policy? How do they manage? With whom what is the collaboration system they have in place to make sure that they can have their say according to the guideline and the national law? So this is the process we conducted. And This is some of the key results in terms of if you see the 5 component of the meaningful engagement of community engagement, so you can see information. They don't have no way to have access to information because first, this is not it's not their priority. They have another priority. Even in terms of consultation, no way. Uh, if you look like this, we conduct focus group with this the internet displaced group. So we make a process, we put in place a process where we have appropriate information, true information. So they are not no ways for consultation, collaboration is zero, empowerment, etc. And then this is you can see the score. See, this is the summary of the score of all the component of the community engagement. Yeah, Eddie. So you have 4, 3, 3. So it's really weak. And this is some organization who can provide support. We make a mapping and you have a specific Excel file with all those information. This is also those who can provide support. This is some of the recommendation of our action plan based on the 5 area of the meaningful engagement of, yeah. And also, maybe the last point is that actually we are lucky because Cameroon started just last month to prepare a new strategy on pandemic preparedness. So because this process is led by a steering committee led by the Ministry of Health, and the Ministry of Health is leading now, is have an ongoing process of building a new pandemic preparedness strategic framework. So because we are working together, we believe that all our recommendations will be part of the key point of that new strategy the country is preparing. And also, we also have a an advocacy component with that lady where you see, because we produce a film to be broadcast on the national television, because we realize that maybe some other people, some partners, they don't have good information, and we need to bring that information if something can change. Thank you.
Merci beaucoup, Bertrand. And just to really call attention, in countries where there's even greater challenging operating environment, it just tells us how much more important it is to invest and to make sure that the most affected community are actually supported to be engaged in planning and preparation for pandemics and responses. Last but not the least, I would pass the mic on to Maria Isabel, and we would go back. It's actually a full circle because Evelyn earlier was talking about the importance of co-creation in pandemic planning, implementation, and monitoring. And this is what Maria Isabel would exactly talk about in the context of defining community engagement in pandemic prevention, preparedness, and response. Over to you, Maria Isabel.
Thank you very much. Good afternoon, everyone. So my name is Marisa Per, Marie Isabel, that's my full name. I am an epidemiologist from the animal health sector, so it's interesting, and I'm going to tell you how much I feel at home here, even though we are from very different sectors. My field of expertise is evaluation of animal and zoonotic disease surveillance and control systems for the past 20 years. I work for CIRAD, which is a French agricultural center for development. And I have co-founded an international organization called PREZOD to prevent zoonotic disease emergence. So this is where we have a link with PPR. So today I don't represent France, I represent 250 academic organizations, NGOs, and operational partners over 60 countries worldwide, including 25 countries politically engaged in the initiative. And the aim of the initiative is to promote prevention of emerging risks through a bottom-up approach, so advocating for and showcasing the needs for engaging community in the prevention of emerging risks. And I will show you a short video to explain what we are doing, and I will finish the story after. How do we start the video? Ah, thank you. And then play.
This morning, Yep, a poultry farmer in Baknin, found dead hens in her yard. The others look sick too. Niambo, a forestry worker in Lesterville, feels feverish since he went into the forest to check on sick monkeys. Sophia is shocked when she discovers her sheep's dying next to the little river close to her farm. Community members are the first to be affected by any health event. They are the starting point and major actors of the health surveillance chain. They report their issues to the local specialists, who refer to their supervisors to get the laboratory team to investigate and seek for the cause of the disease and alert higher authorities. We often think of surveillance as experts looking actively for viruses. This is indeed important, but not sufficient. It doesn't allow the fast detection of the first signs of zoonosis, a disease transmitted from animals to human that can turn into a pandemic. With the community surveillance, we can detect fast enough alarming situations and implement useful actions. That's why their members have to be considered as part of the surveillance chain. They also need to engage back in reporting and responding fast to contain any health event as soon as they face it. We need to support their engagement by listening to their needs and constraints and create a win-win partnership. With the technology and research available today, it's possible to provide community members the information they need and get them to report in real time the events they are facing. Effective prevention of diseases and contamination requires sharing of information in real time at all levels amongst all actors, including the community. This is in line with the One Health approach, which calls for collaboration across human, animal, and environmental health. The community members are an essential part of it. Support science-based solutions with the Prezode initiative.
So this is why I'm delighted to be here, because we really need to build these bridges not only between the animal, the environment health and the human health sector, with the great work that the Global Fund is doing and the strengthening of the prevention, preparedness and response that is happening post-COVID in all the communities affected by TB and other human pandemics, but also to really straighten the bridges between science, society and policy, and we've discussed that a little bit earlier today. Someone says that scientists cannot express themselves very clearly, so this is why we started making videos, because maybe this is clearer, and I fully agree. So we've created Prezode because we acknowledge the fact that scientists need to engage more in advocating for pushing for innovation to be integrated into policy. And some innovation, most innovation that actually work in time and are sustainable happen in the communities. And there is a lot of success story and solution to prevent and prepare for emerging risk that is existing out there, but is not sufficiently visible. It's too fragmented, not sufficiently funded. Investment is important, and definitely not recognized by the national governments and integrated into policy. So this is what we are advocating for, and hopefully we'll work all together and with the Global Fund to do that. I have a little bit more minutes. I wanted to finish the stories, so 2.5 minutes to tell 3 stories is very short. So just to complete the story of Yep with her poultry, for example, what is interesting is that when she discovered her sick poultry, she called her vet. So the vet came to help her. Why did she do that? Because she knew that the vet will kill her poultry, because it's a contagious disease that can be transmitted fast. She did that because she worked with the vets, the local doctors, and the environmental agent in designing the protocol to respond to a threat, looking like avian influenza that could spread to humans. She understood the risk for her, for her family, and she knew that the vets will provide solutions that will not completely undermine our livelihood and our economy. So she had trust, and she needed the help of the vet that came to help her. Then the vet told the doctor local doctor that there might be a risk for avian influenza because he confirmed the disease in the poultry and it's contagious to human. So the doctor came to check on Yep health and made sure that the entire community was not infected. And by doing that, this is the One Health approach. They work as a team in the field. This is how we operational One Health. They talk together and they make sure that if a disease started to emerge from animals to human, it will be contained at the population level and be dealt with. And this is also what we are advocating, is that the solution is at the source. To be able to prevent the next pandemic, we will not be able to stop it if we don't do it at the community level. If I carry on, if I've got more time with, no, okay, so I will tell you the other stories later on. I just wanted to add one more element, which was in line with the discussion earlier. We organized a session on co-design and co-creation in the Geneva Health Forum 2 years ago, where I was very happy to meet and invite Olive. And at the same time, another group that we work with, the One Health Sustainable Forum, organized also a session on pandemic policy. And they got the room and we got the hall. And I think this is very typical. I didn't realize, but now I realize that this is something that happens if you work at the community and with the community. People, for some reason, don't consider that as important as policy. So what we are really pushing is that they understand that without the people, there is no policy, and it's not happening in the field. And without the investment, it's not possible neither. So I hope that next year, we'll be able to organize a full session at the Union, working together, science, communities, and policy. And that in your slides, at the end, in the acknowledgement, PRESOD will be part of it as a science support for improving community engagement. Thank you very much.
Thank you so much, Maria Isabel, and thanks to all the speakers. I apologize for rushing you because I also have a friend here reminding me, friendly but firmly. But thank you, and I do agree we have to continue the conversation. Apologies also to our participants. We don't have time for Q&A. Just recalling some of the key highlights, themes of this meeting. One, at this day and age, we shouldn't keep on defending community engagement, why it's important, why it should be the normative practice, and yet we find ourselves keeping to do it again and again. I guess that's just part of the work. It's important to reach out to partners who support and who fund. Especially in the context of pandemic, post-pandemic prevention and preparedness, some partners recognize the importance of community engagement. Some need convincing, but the important is we have to get it right. It won't just happen. We have to build on existing structures and create structures as needed. We have to reach out to other sectors, but a lot of work to do, especially in challenging and operating environment and context. The need to reach out between community, scientific community, government partners, etc. We all know, but we just have to do it. With that, please, let's give a round of applause to our speakers. Do catch them. They'll just be floating around. There's also other coordinator of the KELG project. Jeff is there. But yeah, thank you, everybody.